Hello, Bart.
Good morning, Milton. How are you?
Good. It's good to have you. Let me to introduce myself. My name is Milton. I'm a student of Grand Canyon University. So this is just a mock session that we are going to talk. So, but let us begin this. What you brought you here today?
Well, I've been under a lot of stress lately, and it's been very hard to relax. So I started taking a cigarette here and there about 4 or 5 months ago. I started out with one, maybe two a day.
Okay.
And I hoped it would relieve the stress in my life.
Mm-hmm.
It really didn't, so I figured I needed to do more. So I started smoking more, sometimes 3, 4, then eventually the last couple of weeks I'm up to a pack a day, and I'm a little worried about my health and my well-being, and I'm a little scared.
Okay, I see. Well, thank you for coming, and that is important and good thing that you are here. So let us talk a little bit, like what are the compounds of the cigarette and why it can affect, your health, and then we will from there, okay? So the thing that we need to know is that the cigarette is compound with there is more than 5,000 chemicals when it's burnt and they are activated. But basically, what happened is that there is 3 main compounds. The first one is carbon monoxide. What happened with that is that it fills the alveolus, which is our small airbags in our blood that we have. They transport the oxygen in our body and lungs, also like the rest of the body. And this gas is like odorless, colorless, tasteless, and what happens is that it replaces the oxygen that is moving in our blood. So the result that maybe people begin to experience is asphyxiation and lack of oxygen in their bodies, so this produces cardiovascular diseases, and also deficiency in psychological function and behavior because of the oxygen deprivation. Another element important in the tobacco, the new, is called tar. This is a black and resistant, maybe, I don't know if you have begun to see in your teeth, changing a little bit the colors. That material affects, your teeth, your nervous nose, to the point that you can lose your smell, okay? So this sticks to the airways that we have, like our whole system and our lungs. What happened with this also is that this increased infections and chronic disease like bronchitis and euphonism, okay? So basically with the tar, what happened is that it damages the cilia, that they are tiny structures that keep airways clean, okay? So it's like our system of the fight against any infection, so it's like decreasing, it's going down. And finally, the third compound of tobacco is nicotine. This is a toxic and produces psychoactive dependence. As you said, maybe that is why it's beginning to be hard to quit smoking. So the nicotine is absorbed rapidly through the bloodstream and a stimulant in the brain called nicotine. Just it goes like in 10 seconds. The nicotine stimulates the central nervous system, the receptors. What happened there, and that is when you feel a little bit relaxed when you are smoking, is because it releases adrenaline that increases the blood pressure and the heart rate and inhibits the gastrointestinal system. So nicotine, by releasing dopamine, the effect is similar what happened with people who use opiates like cocaine, alcohol. So that is why increased dependence. When the nicotine reaches the brain, the effect is reinforced, coming with if you use this cigarette with coffee or alcohol, so it's reinforced. So what do you think?
I think I'm a little worried about my health. Should I be?
I think so. And let's say, being a little closer this what others problem brings. So basically, it's like 3 areas: that cardiovascular diseases, respiratory diseases, and lung cancer. So the result is that blood vessels constrict restrict the blood flow, heart attacks and stroke, can begin to happen. Dangerous mutation in the DNA increase the development of cancer because they compromise the ability of the body to fight many cancers. And even, I don't know if you know, but like from people who died here in the United States from cancer, from 3 people who died, 1 is because they begin to smoke, okay? So some of the cancer that cause smoking is cancer colorectal, cancer pancreatic, cancer stomach cancer, liver cancer, cervical and ovarian cancer, lung cancer, cancer in your mouth, in your throat, in your nose, cancer in your esophagus, in your bladder cancer, kidney, rectal cancer. That's some of the cancer that you can get with smoke. But also, not only that, also it damages your eyesight and weak bones, make harder for women, like for example, to get pregnant. In men, if the one now that you are, I know that you are married, decrease erectile dysfunction, okay? And so, what do you think at this point?
I think I need to think about quitting smoking.
Yeah.
So I think you need to help me because that's horrible news.
And that is great thing that you know, like now that you begin to worry and you want to smoke. And I will say, you know, like that the result is like, if you begin to smoke, it's like almost instant. The good thing that begins to happen to you, yeah. So like for example, in just 20 minutes after you smoke, the heart rate and the pressure return to normal. After 12 hours, the oxygen in your blood increase. After 1 day, heart attack begin to reduce. 2 days, the nervous system in charge of taste and smell begin to recover, like for example, you know, like smelling. Within 9 months, the cilia and air bags begin to recover and improve resistance to infection. In 1 year, your heart disease decrease almost half and blood vessels improve. In 5 years, the risk of stroke disease decrease. In 10 years, the possibility of lung cancer goes down like 50% because of the ability of DNA fight is restored. The bad news with this is that quitting is not easy. The process of the addiction is like a drug, as I mentioned before. So it can cause you anxiety, depression because of the lack of nicotine that is called like withdrawal. So but this is important that you keep in your mind that these effects are temporary and we have tools for that. So what do you think?
Okay, so I am definitely all in for quitting, so you need to point me in the right direction. Where can I go for help?
Okay, well, I'm going to mention, you know, like where you can go, but also before of that, I'm going to, you know, like something important, like, tools, important reason why you want to smoke, so it is very important, as well you mentioned, you know, like to your health. And also, let us keep in mind, don't try, you know, like at once all. Try nicotine replacement, okay? And we are going to mention what are the ones that we have available. Don't do it alone. Come with your family and support, you know, like that is not easy. Let us, you know, like begin to sweep away all the signs of cigarettes that maybe are in your house. We need to increase the level of exercise and reward yourself, you know, like for any success that you may have. And if you relapse and you need to understand the failures, it can occur, okay? But it's part of the battle that you have, okay? So let's see, you know, like some of the options that we have for you in order to quit. So that we have available is there is a behavior-oriented social support groups, counseling, hypnosis, acupuncture. We have a nicotine replacement therapy that includes like nicotine gums. Basically, it's like nicotine, but without the other compounds, okay, that we will affect worse. And patches that you can wear, inhalers, sprays, okay? And also counseling and support groups, I mentioned cognitive behavioral therapy, exercise, and it's like you're ready, free of smoking and back to health. So what do you think?
I think I'm gonna take a shot. I think I'm gonna get healthy. I know it's not gonna be easy, but I won't fail. It'll take me a while, but I won't fail.
That's great. So you are ready to quit, and I'm ready to help you. So let us begin. Like make appointment, and let us talk in the following session, and see, like exactly what is the program and the assessment that we are going to create. And thank you so much for being here, and thank you for because you desire to quit. I know that this is going to bring back, your life, and the right thing is going to happen.
I have the feeling we'll be talking again. Thank you.
Okay. Thank you. You're welcome.